Welcome. Zambia says no final decision yet on U.S. $1 billion health funding, amid confusion and debate. The Zambian government has clarified that no official decision has been made regarding a major health financing arrangement with the United States reportedly worth around U.S. $1 billion, amid widespread speculation that the deal had been rejected. Government clarifies position. Chief Government Spokesperson and Acting Minister of Health Cornelius Mweetwa told the press that the matter remains before Zambia's cabinet for consideration and that the public will be informed once a formal resolution is reached. He urged journalists and commentators to avoid spreading misleading claims that could damage Zambia's diplomatic relations. The controversy arose after reports surfaced that the government had turned down the proposed U.S. support. Mweetwa stressed these accounts were inaccurate, saying Zambia continues to engage with the U.S. in ongoing discussions just as it does with other international partners. Background to the negotiations. The discussions trace back to a memorandum of understanding signed on November 17, 2025 between Zambia's Ministry of Health and the U.S. government, in which the United States committed approximately U.S. $1.5 billion over 5 years to support the country's health sector starting in April 2026. The package was broadly aimed at strengthening areas like human resources for health, medical supplies, laboratory services, data systems, and logistics. However, in recent weeks, uncertainty and public debate have grown about Zambia's actual stance on the deal. Some local and international reporting suggested the government had halted or rejected the funding package, with critics pointing to controversial provisions within the draft agreement that they said could undermine national sovereignty, especially around data access and broader bilateral commitments. Key point of tension: sovereignty and conditions. While the Zambian government maintains that talks are continuing, outside reporting indicates that there was pushback over parts of the draft agreement that were perceived as not aligned with Zambia's national interests. These included provisions linking the funding to co-financing commitments from Zambia, performance milestones across health programs like HIV and malaria, long-term health data access and reporting frameworks, and clauses connecting health aid to other bilateral cooperation measures. Some civil society groups, both in Zambia and internationally, have voiced concern that terms on data sharing and transparency could undermine national control over sensitive health information, and that clear public communication on the negotiations has been lacking. Broader regional context. Zambia's situation echoes similar developments in other southern African countries. For example, Zimbabwe recently walked away from a smaller proposed U.S. health funding deal over concerns about data access and unequal terms, highlighting a growing regional discussion around how international health financing agreements are structured. What comes next? At this stage, the Zambian government's official line is that negotiations remain active and that the narrative suggesting a breakdown in relations with the United States is inaccurate. Whether the funding package will be finalized as originally drafted, renegotiated to address contentious clauses, or restructured remains to be seen. Observers say the coming weeks will be critical for Zambia's health strategy and international partnerships, as the government balances the potential benefits of substantial external financing with sovereignty concerns and public expectations. Thanks for watching. For more content like this, please comment, like, and subscribe to the channel. One Zambia, one nation, one people.